And these scars remind me that the past is real. Papa Roach speaking straight to the mamas on that one. If you've had any perineal tearing or an episiotomy, you know that scar tissue is no joke. To find out if you need to use desensitization to deal with your scar after an episiotomy or perineal tearing, you need to ask yourself these 4 questions. First of all, is my scar healed? Do I feel like there's any drainage coming out of it? Do I feel like there's any gaps between the skin? And the second question is, what did your provider say to you at your 6-week follow-up appointment? Hopefully they went ahead and looked at the tissue if you had any significant tearing or an episiotomy. What did they say? Did they say it looked healed? Are there still stitches that need to dissolve? What do things look like from their perspective? If they think things looked healed, that is a great sign. You need to ask, can I tolerate touch to my perineal area? If I touch it myself, if I'm putting on underwear, at attempts at oral or full penetrative sex, does that area, is it okay with being touched? Does it agree that we should keep moving forward? If not, you need to desensitize your scar. And the 4th question is, are there any lumpy or hard areas in your scar? For instance, if you were to cut your forehead, there would be a scar that would form. And the reason the scar forms is because our body sends a whole bunch of cells to that area to try to heal things. They just lay all down in a big clump. And unless we work on that scar, they're all just gonna stay there in a big clump pretty much forever. And that's why you can still see scars way down the road. But if we work on our scars, which I'm going to get into in a minute here, we can avoid that scarring that might occur. Different types of skin scar more easily than others. African Americans definitely get more scarring typically than me as a white person. And that just means that you probably are going to scar more in your perineal region as well. And so it's okay. We just need to work on those scars and make sure that we are putting in the time so that all those cells don't just clump together and leave this big scar. Because let's face it, whether it's sex that we want to get back to, you just want to be able to do a deep squat to pick up your baby off the floor. All of those things require the skin in our lady parts to be able to move pretty smoothly. And if they don't and they're stuck, it's going to cause us pain. And the last thing we need as busy moms is pain. So once you've asked yourself those 4 questions and you're like, yeah, I don't really like to be touched down there, or yeah, it's feeling pretty lumpy, we need to work on desensitizing your scar and breaking up that scar tissue. The first thing you want to do, if you can't even tolerate touch or even just wearing underwear can be really irritating to you, start with a really soft material. Get like silk from a nightgown or something and just brush that over the area until that feels like, okay, I can tolerate that. That doesn't make me cringe at all. Then move to something a little bit rougher, perhaps like a cotton t-shirt. Do the same thing, rubbing it in all different directions very lightly at first. And can you tolerate that? Once you can tolerate that, you can move to things more rough like a loofah sponge or a washcloth, something with a lot more texture to it. And once you can tolerate that, that is a really good sign that you can move forward to the scar massage piece of desensitization. Now that you are ready to massage your scar, first you want to just start with gentle pressure. I'm referring, I guess, to that scar on my forehead again. But you want to just start like back and forth, really gentle, and then maybe push a little bit harder so that you can get to some of those deeper layers and really try to pull in different directions so that the layers that were adhered are kind of being pulled in different directions. You can go up and down, side to side, pull in diagonals. You can maybe pull and hold. You can go in circular movements, and you're going to work all up and down that scar. If part of your scar is internal, that's when we can either use our finger, or if that weirds you out, you can purchase something like a dilator. I made a whole video about dilators, how to care for dilators, how to use dilators. Click above if you want to get into detail about that. But I'm just going to say briefly, this can be a handy tool to be able to work on getting your scar used to things passing by it. You can hold it on points that are really tender or irritable. And this is just a nifty tool if you don't like to insert your fingers into your vagina to help desensitize and move your scar tissue. those are the basics about scar tissue, and I will say they can definitely hold you up from moving forward with intercourse. So don't think, oh, this is something small. Like, no, this really needs to be addressed. I'm guessing though there's probably other issues that are stopping you from having postpartum intercourse, and that's why I answered this question along with all of the other questions that I commonly get from moms, and I jam-packed all the answers into one video. Link again above or in the description below to get all those answers in one place. And the best part of it is that I surprised my husband. Surprise is kind of a good thing. I don't know if he felt like it was a good thing or not, but I asked him questions candidly like, hey, what about this about postpartum sex? And I wanted his truthful, impromptu answers, and he gave them to me. And I added those into those videos as well to make it a little more fun and also get the guy's perspective. So seriously, you need to check that video out because all the things about postpartum sex are in that video. If you need help with anything specifically, feel free to comment below, sign up for a 15-minute free phone consult with me. I would be happy to answer some of your questions, set you up with either a virtual consult with myself or a pelvic health physical therapist in your area. And most of all, give this video a like if you learned something in it today. Subscribe to my channel if you want to see my videos that come out every single week because I'm covering so many topics about postpartum recovery, how to make the most of our pregnancy, and make sure that as moms, we don't feel damaged after going through the childbirth process. So check that out. Be sure to click the little bell so you get notifications when I put out new videos, and I can't wait to see you all there.